Developing stroke care requires funding, so you need to demonstrate the value for money of your initiative to payers. The Stroke Care Economix tool can help you to facilitate the funding allocation for stroke. It is a modeling tool designed for the assessment of different optimization scenarios to close the care gaps across the full patient pathway. So, how can the stroke patient care pathway be optimized? Let's take a look at stroke onset. Are the patients getting to the right hospital and receiving accurate diagnosis as fast as possible? Are they being referred to the most appropriate stroke specialist? Are they getting access to the most effective treatments without any delay? Once the patients are treated, are they receiving a proper follow-up? With Stroke Care Economix, you will be able to estimate the patient benefits and cost implications of implementing one or a combination of several optimization actions across the full patient pathway, such as workshops, transport optimization, diagnostic technologies, 24/7 service, and rehabilitation program in the short, mid, and long term. Let's take a look at one possible example.
I am leading a recently established comprehensive stroke centre. However, we are currently only performing mechanical thrombectomy to an estimated 30% of all eligible patients. We have identified that the main reasons are: our mean time from stroke onset to puncture is 6 hours. We need to improve the referral of patients to our hospital, as many of them do not reach us. And perhaps the adoption of innovative diagnostic technologies could help us to better identify potential eligible patients and facilitate the referral and decision to treatment. Let's say that by implementing an optimization program that covers identified bottlenecks, we expect to reduce our mean time from onset to puncture by 1 hour. Increase the number of patients referred to our center, and this could lead to increasing the number of patients treated by 20%. What would be the expected patient outcomes and costs? Depending on the relevant data to each case, we might find that 10% more patients could achieve functional independence, and the difference in costs of between a dependent and independent patient is 3 times higher. Adapting the stroke care economics to our needs could help us understand the clinical and economic implications and build our business case for the stroke care improvement.
So, why Stroke Care Economix? What makes this tool unique? First, it is a comprehensive and flexible model that allows you to compare 2 organizational care models over time, a current organization versus a new organization. Considering gradual development in the latter, reaching the optimal number of patients treated can take time. The tool allows you to consider all ischemic stroke patients and all main treatment options. Stroke Care Economix also allows you to consider potential fluctuations of stroke incidence, for example, due to aging population, and you can also model the gradual change in the organization of care over time, providing a more realistic analysis, and having the possibility to follow each additional cohort of patients through their lifetime, meaning you can consider the potential consequences for the society. Finally, as saving times within the care pathway certainly allows to treat more patients and achieve better outcomes, a time is brain factor is included, allowing you to consider the impact of time on outcomes. What is the scope of the Stroke Care Economix tool? To build your business case and convince payers to invest in your stroke care program, the tool provides you a macro picture of the costs and patient outcome implications of developing stroke care over time. A collaborative process with Medtronic is required to adapt this tool to your case, which considers the need assessment, data collection, analysis, and validation of results, and finally, building of the business case. Let's partner together to inform healthcare decision-makers about the value of optimizing stroke care and the meaningful benefits that can bring to your patients. Let's partner together to communicate with impact. Medtronic is your stroke care partner.